When cancer is diagnosed, the doctor will determine the stage of the cancer, which describes the size of the cancer and how far it has spread. Cancer is typically labeled in stages from I to IV, with IV being the most serious. These stages are based on a detailed system that includes specific information about the tumor and how it affects the rest of the body. Understanding the stage of your cancer is important for several reasons. Treatment: it helps the doctor decide which treatment will work best. An early-stage cancer may call for surgery while an advanced-stage cancer may need chemotherapy. Outlook: your recovery will depend in part on how early the cancer is found. Your stage gives you an idea of your possible outcomes. Research: hospitals work with a national database that keeps track of which treatments are used and how well they work. Researchers can compare similar cases to find the most effective treatments. Your doctor will use test results or information from the tumor itself to determine the stage of your cancer. Most cancers with a tumor are staged in 5 groups, indicated by Roman numerals. Blood cancers, lymphoma, and brain cancer have their own staging systems. These stages show how advanced the cancer is. Stage 0, no cancer, only abnormal cells with the potential to become cancer. Also called carcinoma in situ. Stage I, small cancer that is only in one area. Also called early-stage cancer. Stage 2 and 3, larger cancer that has grown into nearby tissues or lymph nodes. Stage 4, cancer has spread to other parts of the body. Also called advanced or metastatic cancer. Tests like blood and imaging scans are used to determine the clinical stage. Imaging scans may include MRI, CT scan, and ultrasound. A biopsy may also be performed to examine a small piece of tissue under a microscope. If surgery is done to remove the tumor, the doctor will learn more about it and its effect on your body. This information is used to determine the pathologic stage, which may differ from the clinical stage and is considered more accurate. The TNM system, which stands for tumor, node, and metastasis, helps your doctor determine the overall stage of your cancer. They will measure each of these factors and assign a number or X if a measurement can't be determined. Here's what each symbol generally means. Tumor, T followed by a number from 0 to 4 indicates the size and location of the tumor. T0 means there is no measurable tumor, while a higher number indicates a larger tumor. Node, N followed by a number from 0 to 3 indicates if the cancer has spread to your lymph nodes. N0 means lymph nodes aren't involved, while a higher number means the cancer has spread to more lymph nodes. Metastasis, MM, is followed by either 0 or 1, indicating if the cancer has spread to other organs and tissues. 0 means it hasn't spread, and 1 means it has. In addition to the size of the tumor and how far it has spread, doctors also consider other factors to determine the stage of cancer. Grade: this is how cancer cells look under a microscope. Low grade means they look similar to normal cells, while high grade means they look very abnormal. Low-grade cancer cells grow more slowly and are less likely to spread than high-grade cancer cells. Location: the location of the tumor in the body can affect how difficult it is to treat. Tumor markers: these are substances found in the blood or urine that are elevated in certain types of cancer. Genetics: the DNA of the cancer cells can provide information about the likelihood of the cancer spreading and which treatments may be effective. When you are diagnosed with cancer, the stage at which it is found typically remains the same, regardless of any changes in the disease. For instance, if you are diagnosed with stage 2 lung cancer, it will continue to be referred to as such, even if the cancer spreads or goes into remission. This is important because the treatment options and chances of recovery are often determined by how early the cancer is detected. In some cases, cancer may be rest-staged after treatment or if it recurs, based on new tests.